Welcome to Coaches and Clinicians, a podcast where performance meets medicine. Here, we bring together coaches, clinicians, and leaders in health and sport to share their practical insights on training, recovery, and rehab. The information discussed on this podcast is for educational and informational purposes only and is not intended as medical advice. Nothing shared here should be used as a substitute for professional medical evaluation, diagnosis, or treatment. Always consult your physician or other qualified healthcare provider before making changes to your medical care, medications, training, or activity levels. I'm your co-host, Dr. Parshall, and I'm joined here by
Coach Tony. How we doing?
Doing well, brother. This is exciting. Is that the first pod?
First episode. Welcome to the pod.
Welcome to the pod indeed. Now, we're going to go ahead and talk about a couple of things today on this intro podcast. But before we kind of get into all that stuff, I just kind of wanted to get your thoughts on why did we start this podcast?
I think if you're an athlete or if you're a student who is going to be a chiropractor, a student who's going to be a physical therapist, or you're just looking to enhance your quality of life, whether you've had an injury or you're looking to increase your performance, whether you're a high school student or even just an adult, the way that we are able to connect all of those and increase your knowledge in all aspects.
Kind of hit the nail on the head on that one. It's like, we don't want to say it's for everybody, but at the base of it, it kind of is, right? Like we see the high school athletes, we see the first time in the gym, we see these retirees that are coming in like, hey, look, turns out I want to be able to live really long and go travel and do all these really fun things. And we get this wide spectrum of people who have injuries, people who want to get better at their respective craft, whether that be pickleball, hockey, basketball, baseball, football, you name a sport, we got it going on here. So it's a pretty cool little avenue that we're trying to open up here.
Yeah, definitely. I mean, when you hit the nail on the head there, we see so many aspects of sport, rehab, that all under one roof to where, it's an easy communication between all of us.
Yes.
Especially as an athlete who is, let's say hockey, for example, you're on the ice, it's a physical sport, trying to get something done, and it's an easy communication between us. So, I think, you hit the nail on the head right there.
And you said it best. And that's what I like. I want to talk a little bit about the communication aspect. Because I feel like that's what another big reason why we wanted to start this podcast is the miscommunications or lack of communication. Because, we have the doctor, you have the clinician, then you have the athlete or the patient. Now, we're all trying to get the same thing. We all want the same thing. You're a coach, you want your players to excel. I'm a clinician, I want my patients to excel. I want them to get better. But when I'm talking to somebody, when we're talking to each other, we have a better communication because we're here. We know what each other are doing. We understand. It's a quick like that. We could talk about it. But out there in the real world, what I'm noticing is that we're not necessarily getting that same language talked about. We all want the same thing, but there's a miscommunication, whether you think like, oh, the clinician might think, oh, that's too medical, coach, stay in your lane, or vice versa, right? Like medically you might be cleared, but as a coach, you're like, hey, it's not fully what we want to see, not back to real playing style, So I think that communication aspect of being able to kind of hone that in on both sides, find that middle ground is going to be really important.
Yeah, definitely. I mean, lucky for us, it's all under one roof, but there are times where I get an athlete that come back from an injury, they haven't seen either you or any other doctors in here, and they say, well, I can't do this. I relay them to you guys and like, well, this looks completely fine. And then just the aspect of me having to change the programming based on around whatever that injury may be, or whatever's just nagging at them, it's just an easy fix. I don't have to sit here and they're saying, well, I can't do this anymore. And then I'm going to sit here and say like, well, I'm not going to listen to him because I've had you for 3+ years. So, it's an easy thing like, hey, what is it that you see? What can we do to get better? What can I do to incorporate that into the program, whether that's making a change or just adding it in? And then the player is just ready to get back into their respective sport.
And I think that is largely where we are heading as a whole. Okay? I see that happening in more and more offices, talking with more and more clinicians, more and more physical therapy places, a little bit more private owned physical therapy places. I feel like are kind of moving towards that realm. And it's an exciting thing. It's an exciting thing for our field. It's much more like I think back to when I was a younger athlete. We didn't have all these cool things and nobody really cared about it. Like it was, you got to move, you move a lot, 3 hour practices, garbage bag on the ice, no waters, nothing, right? That's not really there anymore. So I think that with that communication aspect and is really starting to kind of, we're starting to understand that it's not a one size fits all kind of thing. You know what I mean? It's not a, just because somebody says it doesn't mean that it's 100%. And that's a big thing.
Yeah, definitely, especially um, which we'll get into here in a minute. But especially with you, you are not only a clinician but a coach, so you have the best of the best of both worlds of seeing, you know, what is it that your players are doing, what can you do to help excel them in all aspects. So I really like that. Yeah, I really like what you said there. That's perfect.
Thanks, Stones. Now, I think we kind of got a little ahead of ourselves on that one a little bit. That's all right though. It's the first one. We're doing well. This is good. Now we've kind of hit on a little bit about what we've done, but as the listeners, I think we owe it to you guys to kind of give us a little bit about ourselves, a little bit of knowledge about ourselves. So, Tony, I would love for you to tell us about your background and like how did you get started with coaching?
So for me, I started coaching when I was 18. I initially was going to go to school for film and editing. Luckily enough for me, I was pretty close with one of my gymnastic coaches. He was in an area that was kind of be like a nice little fit for me at the time. Didn't work out. They weren't hiring anyone, but luckily for him, he was like, "Hey," or luckily for me, I should say, he was like, "Hey, I'm still coaching gymnastics. We're looking for a coach." For me, I was one in need of a job, two just wrapped up my season, so I was like, "Yeah, why not give it a shot?" So coached gymnastics for 5 years. Um, there's a little bit of gap in that coaching after that, and then I started personal training, got back into performance training, and I met Dr. Kevin, I want to say 2019, at another gym. And then once the ball got rolling with his company, been here ever since. So coming on over 10 years of total coaching. Yeah, it's a long time.
Congratulations, dude. Now, I'm sure that there was a bunch of things that you've learned and taken away from those long years of experience. So I'm interested to know if like you have one thing that kind of stood out to you as to making you who you are today.
For me, I would say being the coach that I am today, I'm heavily involved in not only coaching, but with my athletes, aside from um, making sure that I'm demonstrating everything correctly. We have events that we hold here that we all participate in. Um, and I feel like that's just always been the way that I've coached. For me, luckily, I've always had younger coaches too. So seeing them involved, looking back on it, they were also involved with the way that like my development was. They were never really like um, the old coaches that were just like overweight, standing on the sidelines. I had that experience when I was younger. I didn't really like it because it's like, why am I going to listen to you? Um, so when I got a little bit older and the younger coaches started being a little bit more involved, I saw how they coach. So looking back on it, especially now, I would say that's my style of coaching. Um, and I think it's helpful for the athletes as well. I mean, coach mainly high school athletes, and a lot of these high school athletes want to see what you're made of. Like, why are they going to listen to me, who's one, not their parent or their sibling or anything along those lines? So why would they listen to me instead of just, oh, this is just a coach. He's just going to stand there. Because some, unfortunately, kids still experience that. Um, so being involved with them, and I think that really helps development, especially at a young age.
Like you do practice what you preach. Like you run the programs that a lot of these athletes are doing in the offseason. I mean, that is very, very important. And it's very hard as a coach and or as a clinician to be like, hey, go ahead and do this, and then you can't even do it. Like, why would you go ahead and listen to somebody who's telling you to do a power clean if they can't even do a power clean, you know? So thank you very much for sharing that background. It gives a lot on the inside of to kind of what brought you to here and to kind of what led you to be that kind of coach that you are for a lot of these players. And it's pretty remarkable to see, getting to see you work with a lot of these athletes every single day. I mean, it's a really special thing to see the bond that you guys have created. So good on you on that, coach. Good on you on that.
Thank you. Thank you. I appreciate that. Now, I want to relay that same question back to you.
All right.
What is your background?
So I I have an undergrad degree from Lewis University in exercise movement science. I have a doctorate in chiropractic from National University. Prior to that, I was a hockey player. I played some youth hockey out in Northern Illinois, and then I ended up getting lucky enough to play junior hockey. Bounced around a couple of teams there in a couple different states. It was very, very fun. In that time, I encountered a lot of injuries. I spent a lot of time in the training room. Spent a lot of time in the weight room as well. So I got to work with trainers. I got to work with the PTs. I got to work with the chiros. That brings me up to where I was first introduced to chiropractic. The whole thing that you guys see online, and I mean, I see it online all the time, like the crack and whack, it done and you're good. Never really had that. It was more or less like they truly understood movement. They understood my sport. They knew what I was doing on and off the ice. They were working with each other. So they knew like the extrinsic load of physically that I was taking on. So I really, really found that interesting. I really loved that. And it really propelled my career, and it kept me progressing, but also living through some of these injuries that I was able to do. I was able to play through some injuries. I was able to get through it, but I was able to do it well. I was able to do it well under the guidance of proper coaching and proper practitioners or clinicians. So then that brings me to, I said I went to Lewis. I played college hockey there for 5 years. I went through COVID. There I was a captain for the team, and now I'm actually in my third season as the assistant coach for Lewis, which is fantastic. This will be like the 9 calendar years with one program, which I'm very excited. 5 playing and then four coaching. And I just graduated Cairo school in December. So,
Let's go, dude.
yeah, very exciting.
Shout out Lewis.
And national. But I am now a doctor of chiropractic. I hold that degree, and I'm going to be pursuing a more sports-based background in that, completing an additional certificate, which will hopefully lead me to be a little bit more honed in with these athletes. So yeah, man, I've been in school for a long time, getting out into the things. I'm just like to. I've been personal training with Synaptyx. I did my undergrad internship here, which was very, very nice. I got to work with a lot of really fun people, really great people, trained them for a while, and was able to do my preceptorship here, and kind of walked into now the position that I have as a physician and trainer here. So I'm a little bit mixed in the sense of treating patients and also doing some personal training, some sports performance training like yourself. Yeah.
That's awesome, man. So now, being in school for that long and also playing for the same school and doing all your studies and playing at such a high level, would you say dealing with the injuries on top of school, what kept you focused throughout all of that? Because that's a long time.
And I think like the light at the end of the tunnel, right there, I had a goal, much like in the gym. Like I think back to like high school, it's like, all right, yeah, you want to bench 225, you want to bench 2 plates, great. Want to do that, you get there, you're like, all right, what's next? So I kind of always had that mentality, but I truly wasn't able to do the things that I wanted to do until I got to this level of like this degree, being able to diagnose and treat a majority of musculoskeletal based conditions. So just having that ability, like seeing the end in sight, was very, very gratifying. But ultimately, like being able in connection with so many people, so many good people in this field, it really inspired me to keep on going and going and going, and to become like the best coach and clinician, because they blend a lot, right? Like we're the same. coaches and clinicians, we're all the same. Like we were talking about earlier, we want our patients, we want our athletes to excel. We want them to do well. We don't want to harm them. We want to do it in a good time frame. We want to honor what they want to do. So that was ultimately what kind of kept me going throughout that whole entire time. And plus, I like to learn.
That's good. I can kind of agree on that for myself. Like the older I got, the more I wanted to learn, especially like in the field that we are currently in.
Which is always changing, by the way.
Oh, all the time, all the time.
Like, I mean, you can, I know you can, because we both can do this. Talking about something that was like, oh, that was the bee's knees back in the day. 5 years from now, we're like, that was so dumb. We're never gonna do that again, right?
Yeah.
Right.
New research, new methods. Everything's always changing, or what's old is new again, and we'll get to that eventually.
Yeah, and that's part of the goal of this podcast, is cut through that noise to get a single spot to where like you can go and be like, all right, we have the doc, we have the coach. What are they thinking about shoulder stuff? What are they thinking about hitting that next PR? What are they thinking about for how do I lose weight while not losing as much muscle mass? Like these, not just athletes. We've talked a lot about athletes so far, but we're forgetting about the other half. The reason that these athletes can be the athletes, and those are their parents, those are their coaches, those are the older people that they encounter every single day, their grandparents, right? They're all the same. Like the grandparents want to be able to go out and throw the baseball now. They want to be able to walk and carry their kid. I mean, it's truly remarkable to see what the years have done in terms of this healthcare space. Because back in the day, I remember you could smoke cigarettes inside of bars and like in restaurants.
It really wasn't that long.
No, it was like 20 years ago that you could do that. I mean, and then eggs were bad then too, but now they're good. There's so many things that need to be combed through or need to be talked about, or at least we might not be the experts in it or might not know 100%, but at least we're challenging that thought. We're talking through it using both of our heads, using our experience from what we've seen over your 10 years of coaching athletes, very high level athletes as well. And then not only that, but your background that you've seen in your sports. So I think that's a really good, hopefully a really good thing that we can do for the healthcare space, the health and fitness space.
Yeah, I think we're going to touch on a lot of things in here, especially after this first episode. I'm excited for the guests that we do have lined up. Especially, getting to know Dr. Kevin, Dr. Ryan a little bit more.
Those are the owners, by the way. Dr. Kevin, Dr. Ryan, they were the brainchild of Synaptyx, kind of that gym clinic hybrid. Maybe not they didn't make the gym clinic hybrid itself, but as we see and as you guys will see on the social media and throughout our more episodes, you'll kind of see that gym clinic hybrid is kind of what we're rolling with. And they're going to speak a lot to that in the coming episodes, which is fantastic. We're really excited to have them on, as well as Dr. Zach, our physical therapist. We're very excited to have him on as well.
Zach's also going to be a very good one, especially with his background in physical therapy, but also being growing up in athletics as well.
Oh yeah, college football player. Yeah, I mean, we'll let them talk about it. We'll let them talk about it. But it's exciting. We're really excited to share a lot of these guests that we have. We're going to be, like we said, we're going to be bringing in some leaders and pioneers in this space, and it doesn't necessarily mean it's going to be a doctor or clinician. It could be talking about some nutrition as well. Yeah, that's going to be exciting. Now we kind of touched on this throughout, but I do want to know if you have like one thing that you will never promote. And you could say, hey, look, I don't have that information right now, but do you have anything off the top of your head that you'll never promote in the show?
I'll probably never promote, just because the way I feel about this ever, and to me, it never made any sense, is these cult-like movement systems that you see on like social media, or unfortunately, the parents, the grandparents, the adult fitness clients do end up falling for it.
Misinformation, like that misinformation. Yeah.
Yeah, just the whole misinformation on everything. You will never see me promote that.
Right. And, I think kind of speaks to little bit to like that one size fits all thing, right?
Yeah.
Like that one size fits all is we as a whole are probably not going to tell you a blanket statement here. Okay. We're not going to tell you everything's wrong. We're not going to tell you everything's right at the same time. Like that one size fits all program, what works for you might not work for me. What works for a 14-year-old might not work for a 45-year-old. What works for a 45 is not going to work for a 75. You know, like there's this whole wide gamut of things that we have to take into account, whether, the athlete's predisposed injuries, their level of skill, the amount of times they're playing, like the amount of, especially with high school athletes, it's remarkable how much they're moving.
Yeah, all the time. On top of dealing with stressors of school, whether they are just in your normal classes, if you're in honor classes. I mean, even going back to the adults, you have to think about, the 45-year-old who's probably working a 9 to 5, or they got kids, or, those other stressors in their life, but also their experience that they've built up with their whole life. Like, have they been dealing with a nagging shoulder issue or something for some time? So, like, like you said, it's not going to be the same of a 45-year-old to a 14-year-old who has, all right, they're both dealing with the shoulder issue. What's the difference? Like, there's not going to be like, we're only going to do this and we're going to apply it to both of those. Unfortunately, that's never going to really be the case.
And news is we're going to give you the answers to a lot of these things in the coming episodes. We're going to definitely provide a lot of this information of there's going to be truth to a lot to some of these things. There might be like the weird thing, there might be some truth to it, but there are also just about how you're applying it, the words that you're using, the way that you're using it is going to be ultimately what really matters in that situation.
Yeah, and I think that's very important, especially, again, if I'm talking to an adult compared to a kid, I am most likely not going to use the same language. It's going to be different.
But at the base of it, push, it's pull, it's squat, it's a carry. I mean, like you can go down the main movers, like that's what it comes down to. Yep. Yeah. And, there's only, we'll break down this stuff. But there's some nuance to it. The nuance, I guess, is going to be left for the coaches and the clinicians to deal with. As the listeners, just know that there are other avenues, and there's always a place for you to ask questions. We are a place that you can reach out to, talk to us. You guys can provide some questions that you have, and we can do some Q&As down the road. I want this to be mainly for the listeners here and what they want to learn or what they've heard and stuff like that.
Yeah, a Q&A would definitely be huge, I think, especially since we have such a broad spectrum of people that come in here. Athletes, adults, you have patients,
pre-op, post-op,
all the time. We see it all in here.
Total knee replacement, total hip, both, all the above, disc herniations, surgeries. It's a very cool spot. It's a very gratifying spot because it's not mundane. It's not mundane. So, Tony, I mean, this is exciting.
Wow. We are a little bit ahead of schedule here.
A little ahead of schedule. I think we could probably fill it up with a little bit. Dude, I got another question for you.
We got at least 8 more minutes.
8 more minutes? All right, dude. Okay, we'll get ready for this one. I think the answers to this question will be, you guys will already be able to answer them. But were you originally drawn to performance or medicine first?
Performance.
Okay, sweet. Now, go into that a little bit more. Like, what was your first taste of like, this is what I want to do?
Like the second year I was coaching gymnastics, I was like, I want to do this. And if I'm going to do it, I'm going to go all in on it. So once, I really got to see the progress that all the girls I coached made and have them win state at the levels that we coached, I was like, this feels good. And they see that the progress that they've made throughout all the months and the hard work that they put in, it paid off. So for me, that was probably like what drew it to me, like initially. Post gymnastics, I don't know. I just had like an itch. It was just like, Like that was just what I was used to.
As we say in the hockey world, you couldn't hang them up.
Yeah, exactly. I was like, as I love coaching like the adults and everything. Like I said, it's very different. But also when I was doing that, yeah, I just couldn't hang them up. I was like, I gotta get back. I gotta get back in there. So yeah, I would say that's pretty much what drew me. Now for you, which one was it initially?
Initially, it was performance, and then it went to medicine very fast.
What would you say like what was the switch? Like
So I guess like I I wanted to just be. I was a big kid playing football. Okay, I couldn't carry the ball. I was a little too big. It's a safety risk, and I was playing on a little older kids because I was a little heavy. And I wanted to get out of that. I wanted to change that. I knew that it was possible. I mean, I was young, so I knew it was going to kind of go away, right? But when you're a kid, it doesn't seem like it's going to go away fast. So I was introduced to like sports performance training relatively young, throughout football, as a means to kind of lower the weight, and it ended up being very 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 fun. That kind of like honed me in sports. I'm like, yep, I'm gonna play sports for the rest of my life, which I thought was going to be football. That switched to hockey when I was about like 12. I would say full time was switch over to hockey, and around 12 was when I kind of like that, like getting into high school. We had a medical academy in high school, and that was the greatest thing ever. It was so fun. I had like sports medicine in sophomore year of high school, where we were just taping.
that's actually huge to like think about. Like back then too, like that's actually insane to think about.
2012, 2013, 14, and like those times, like I was stitching in high school. It was a wonderful program. With Project Lead, the way I speak very, very highly of it. It's fantastic. It is great. And so from there, it's always medicine. From there's been no point in my life where it went back. Um, and now, like, am I performance now? 1,000%. Am I traditional medicine? No, I'm not. I'm not a Western medicine hater by any stretch of the word. I'm not like I do not hate medications. I do not hate like pharmacy. Okay, like I'm okay with that. There's a time and a place for it. So being able to be that doc where I'm a little bit more performance, a little bit more hands on was really really special. So I kind of like like in the background I was talking about, I got introduced to the Kairos when I was like 17 or 18 years old. So from there, it's been pretty honed into the performance side of medicine. That's why I really, really like the sports chiropractic degrees, because you get that performance aspect, but you're also still treating. You're part of the day one. Like a lot of my guys that get injured, I'm the first person that they see after their injury, and I'm the person that discharges them, which is a very very gratifying feeling. Similar to, you see them at the beginning, you see them excel, you see them at their lowest, but then you get them to their best, and that's really really where I kind of like was like, yeah, medicine slash performances for me.
Touching on that last part is going back to like what you said. It's all the same. We want to see everyone excel and get them back into whatever it is that they like doing.
And I know that that's kind of a blanket statement that we keep on saying it's all the same, but give us a little bit of slack on that one, because it, the base of it, like the concept is always that it's the same. The concept is to load a tissue. The concept is to get stronger. The concept is to get faster. The concept is to get more flexible. Whatever you want to do, and then there's 1,000 buckets to pull from there. Now, Tony, a little bit more of a fun question. If you were to close your eyes, I'm throwing you on the spot for this one, so take some time. If you were to close your eyes,
My eyes are closed.
10 years,
10 years.
what do you see yourself doing? Where do you see yourself as a coach?
In 10 years, I see myself still coaching, but I do see myself taking a little bit of a step back.
Very nice.
Only because I'm saying I mean, in 10 years, like I'm like barely going to be 40, which like coaches are still coaching in their 40s. Not disrespecting them at all, but I've already been coaching a long time. In 10 years, I want to have a family, I want to have a house, I want to be involved in my kids' lives as much as I can. So I can kind of see myself taking a little bit of a step back, whether that's like through the online space or um, doing like weekend seminars of like speed or like camps or anything along those lines. Like I'm always gonna love coaching. I do have other interests that I would love to get started within the next 10 years. But I mean, you never know along the way. I mean, like I said, I'm always going to love coaching, but I do kind of see myself taking a little bit of a step back at some point, you know. But who knows? Maybe if I do step back, it could just can't hang them up, dude.
Nice. That's true. That's true. It's hard. It's hard to do, man. It's hard to do.
It is. I will say that it is very hard.
And when you're good at it, you're good at it, right? It's hard to stop. All right. What was it, dude? I forgot the question. 10 years, right?
10 years. So you got to close your eyes.
10 years? Okay. All right, 10 years. In 10 years, still doing the same thing. I would love to have worked in Olympics at this point. I would love to have work with the Olympics. That's end all be all. That's going to be the coolest thing ever. But ultimately, I want to just be a part of as many patients' lives as possible. I would like to have made a difference in as many people as possible. In 10 years, I do anticipate things being a little bit more scientifically advanced. So I'm excited to see what that brings for our space. I'm excited to see what is changing now. There's some laws changing when it comes to nutrition and the additives. The peptide space is a very weird enigma right now. So I'm excited to see what that brings for us. I do hope to be working with a little bit more of like the orthopedic surgeon side of things. I would love to create a one-stop, like kind of what we're doing here. I'd love to see this grow further into more of that hospital-based setting of where we can kind of set a change from a little bit more within. I just ultimately I would really like to see, maybe we bring some gyms into some hospitals and get some training in the hospitals, get some massage in there. Cause I mean, the doctors work hard.
They do.
Doctors are on call for, some of them are in there for a week, depending on what you're doing. Some are in there for 48 hours, bringing it from everybody, getting healthcare and the knowledge to succeed and to hit your goals would be awesome.
I think that's also another one that you touched on that I should have said is that everything's always changing. So it's like, even in 10 years, like, what I could say now of me taking a step back, if there's some shiny new toy where I'm like, oh, I'm gonna grab that, we're gonna rip it, and So, but I do like the hospital take. That is very important.
15 years ago. Now I'm a young clinician, and maybe some other places, some of the older practicing doctors can speak otherwise to this, but as a part of these gym clinic hybrids, I don't necessarily think they were that big 20 years ago. I don't think they were that big. I didn't really have one. I mean, I knew they kind of existed. They were always reserved though for these like professional sports teams or the high level Division I where they have massive funding. But at the end of the day, it can be done without that. Everybody should have access to, under one building, they should have access to everything that they need, whether it be nutrition, whether it be physical therapy, whether it be chiropractic, call it whatever you want to call it. They should have access to it. And that's what I really want to do. And if you're not near us, that's fine. We want to give you at least the ability to maybe hear something you didn't hear before, to maybe ask that question at your next doctor's appointment, kind of like, or your physical therapy appointment. Say, hey, look, I found this. They were talking about this. What do you think? Just starting that dialect. I think that dialect's going to be really important. Yes. To push this ever so changing field in the coming future. I mean,
we got one more on there.
Yeah, we could. Okay, let's see.
Got one more on there.
Oh yeah. What is one thing you're excited to talk about or explore on the show?
I can name a few things. I'll start with one of them would be the recovery aspect of things, whether that's us, the other guests that we have on the show, and by like recovery, I mean we both got a whoop on. Are we gonna follow those metrics to a T? Are we gonna worry about contrast therapy?
What do they mean? When to do it? How to do it? What to it?
Yeah, like what? Do I need to want to sleep 4 hours a night and then stay awake for another 4 hours and then repeat that?
The sleep cycle. Yeah.
just
It works best for high performing people if you sleep 4 hours.
So touching upon all of those things, I'm excited about because there are recovery tools that I use for myself. There are recovery tools that you use for yourself. And then getting to know what other people use, what's going to be actually working compared to what's people are just talking out of their ass.
I mean, you stole it from me. I do want to, that was mine too, but it's okay. It's okay. I love it. I like it. The recovery tools are super, I mean, super useful. Are they the end all be all? No, nothing is, right? But at the end of the day, they're tools, and there's a lot of data out there. There's a lot of different wearables, all of which are tracking kind of the same metrics. Because it's kind of hard to track anything other than what they can track. You got your heart rate, you got your variability, you got your skin temp, you got your respirations, you got your sleep time, the quality, all that good jazz. Now, what does that mean? So we'll go through. We're gonna have a full episode talking about what those mean. It's gonna be fantastic. Really excited to talk about that. I am actually really excited to hear Tony speak about programming and the different aspects of programming.
Yes.
Because we've talked about it a little bit before. The one size fits all, not your model. But I do know that you do a bunch of really exciting and really, I would say, not like cutting edge. They're what you should be doing, but not a lot of people are doing them. And you are doing all the cutting edge and the best things for a lot of these athletes. So I'm really excited to hear about the different programming aspects and how to program for different athletes in their season. This could be really exciting. From another personal aspect, I'm really excited to sit down and talk about with some doctors, with some orthopedic surgeons. As a chiropractor, as a clinician, I get a lot of people with like back pain, asking about the surgery. When do I need to get surgery? Personally, I get a lot of people that are trying to stay away from the knife, not like a go see PT for 6 weeks and then we'll go ahead and do the surgery. I'm not necessarily getting that. I'm getting, hey, look, think I got a disc. Well, let's go get it checked out first. Yeah, you have one. Okay, let's go ahead and try to keep you out, but we're going to work with this doctor. So we're going to bring on that doc, and he's going to talk about what that means for his line of work. What does it mean to get a surgery? When is the right time to get that surgery? What does it look like after the surgery happens, and what is that process like? So I'm very excited about those 3 things, I guess, kind of preluded 3 things.
Got a lot of exciting things coming up here.
And, on the next episode, we are going to be joined by the owners of Synaptyx, Dr. Kevin, Dr. Ryan. They're going to discuss how they built that gym clinic hybrid that we were talking about, and how to train through injury when done correctly. It can be beneficial.
Very true.
We're excited to have them on. Tony, fantastic first pod.
Hey, we got it done.
We got it done indeed. So to all the listeners out there, thank you very much. Bear with us on the first podcast. It's probably not going to be perfect, but at least we got the worst one out of the way.
First one up soon. By the time you see this, it'll be up. You're just getting the gears worked out a little bit, but definitely more to come. We're excited to get everything rolling here, and I think you guys are also excited as well, hopefully.
Now, if there's any, so you can find us on our social media accounts. We got Instagram.
We got Instagram, TikTok, YouTube are the main 3. You can find us all on there at Synaptyx Performance. You can also find myself at Tony Caruso. You can find Dylan at
Dr. Dylan Parshall.
I believe that is it.
Yeah, if you have any questions, feel free to send them our way, and we'll add them to the list. Get in that Q&A episode. We'll build up some questions and get that Q&A episode going for the future. But thank you very much for tuning in, and we'll see you on the next one.
See you in the next one.